Healthcare reform, you might be wondering, is it really falling apart in progressive Democrats? Are they really as furious about it as they are on talk radio and in the blog sphere? Senator Ken Conrad says fighting for a public option is, quote, wasted effort. He says that even though the Democrats have 60 senators, they don't have the votes. So everyone needs to get on board with the co-op plan. Liberal Democrats are not going to take this lying down. Nancy Pelosi, Charlie Rangel, the Progressive Caucus, members of Senator Kennedy's committee have all said they are not willing to give away the store on health care. They already compromised when they gave it up on single payer. The public option was supposed to be the compromise. Now the goalposts, I guess you could say, have been moved. So where do we go from here? I know that there's a lot of liberals in this country right now that are going, gosh, wait a minute. This doesn't sound like Obama. He's been such an upfront guy all along. But this isn't Chicago politics. This seems to be like coffee shop politics where nobody gets upset with anybody and there's really no pushing going on. You know what I mean? Nancy Giles, Sam Stein, and Ron Christie back with us tonight on our panel to talk about this. Sam, let's talk about co-ops. You have written a piece in the Huffington Post about co-ops. Is there a history here that the American consumer can point to see if this has any chance of working?
Yes, there's a 2000 GAO study on co-ops, a variation of co-ops, and the conclusions were very sour on the idea. Essentially, co-ops don't have the purchasing power to really create systematic reform that the president has talked about since the very beginning. They're limited in their scope in terms of how many people they can actually get under the umbrella. They're very ineffective in terms of lowering administrative costs. And as you mentioned earlier, private insurers would be involved in the process, and they're doing everything to protect their profits. So in terms of policy ideas, I'm not sure that this is much of a smart compromise for progressives or Democrats to make. In terms of politics, maybe it's good to get the votes. But keep in mind, the votes you need to get aren't Republicans. The RNC just came out and said they oppose co-ops. So Democrats are essentially negotiating against themselves on this. The votes they need to get are conservative Democrats. And that's where party leadership like Harry Reid, and including the president himself, need to put down their fists and say, listen, this is what we want, and this is how we're going to get it.
I'm all about it. Ron Christie, the last time you were on this show, you identified yourself as a healthcare expert. Buddy, I'm all about it. I need to know if these co-ops have a life expectancy. Do you think that it has a pulse with the Republican Party? Is it a viable way to go?
I don't think it's a viable way to go. I think Sam's analysis was pretty much spot on. I don't think that some of the versions that we've heard about co-ops are really going to have the buying power to make a significant difference. If you want to talk about a way, Ed, that we can really have real health care reform right now, why don't we loosen those regulations that do not allow you to buy insurance across state lines? That would be one very tangible, very relatively easy thing for folks in Congress to do to allow more people to have coverage. But this public option or the sense of a co-op, I think, is dead on arrival. Senator Conrad's right. They don't have the votes. The president needs to work with Congress on behalf of the American people to put something in place that will lower costs, and I don't think that we've seen that thus far.
I just want to make sure that the American people don't forget this. Let's go back to November last year, right after the election. Senator Baucus had a plan out. The Baucus plan envisions that Health Insurance Exchange would offer a new opportunity for individuals and small businesses to easily compare private coverage options and a public plan, and to purchase the policy that would work best for them. The exchange would include a new public plan option similar to Medicare.
Public plan.
What happened,
Medicare.
Nancy?
And I have no idea.
He caved big time.
Well, but he's getting a lot of money from insurance companies. I mean, let's be honest. We have to say really what's going on out there. And not only that, I think it's important to remember, I think we have the votes in the House to push the public option, and we can't forget that. And we also can't forget the fact that it's being talked about. Nothing happened with health reform over the Bush two-term administration. We are getting there. I don't want to throw everything away. I just don't want to feel totally negative.
I mean, you've got the Secretary of Health and Human Services saying that it's not an essential part of it. It's not essential. What is? I mean, Ron, how are you going to reform the system if you don't have a pre-existing condition erased from the element that we're facing right now? And I'm out of time. We're going to have to answer that another time. That's the way it goes. Earlier, I asked our audience tonight what you thought. Will no public option mean a loss of support for President Obama? 88% of you said yes. 12% of you said no.